I'm so pleased and honored to be beside two learned people.
Yeah.
And 2.5 learned people. So
look at you. How do you know they have halitosis? Do they have to do like, and you be like,
I was named after a very close family friend
okay.
of my mom. So
was he a rapper?
No.
Let's go.
Let's check it.
Afi, the girl's mouth was really smelly.
At first glance, what do you think of my eyes?
Oh God.
And she wants me to give her brand new teeth at her age. And I was like, hey, grandma.
Don't you get like headaches and like eye strain?
Not really.
Are you sure?
Next week, people, you see me at Whitestone with my lab coats. Don't ask questions.
Don't ask questions. Rasta doctor.
Stay by plan, Accra, stay by plan. All the boys, all the girls, for stay by plan. Stay by plan, stay by plan. All the boys, all the girls, for stay by plan.
Hi guys, welcome back to no. I said I was changing it. I'm sorry guys. Let's backtrack. Good day to you all. Good day to you all. And today we're in the studio with some very neatly dressed people. So that's why I have to change my English and also sound formal. And
Oh, man.
I'm just so excited every time we have serious but not so serious conversations, because I have a lot of questions to ask. And yeah, I don't know, I'm just excited to be here. I know Zuu is excited to be here.
I'm so excited, guys.
And we have two people in the studio. I'll just let them mention their names, and then as the episode goes on, you know like more about them and all that. Okay, so hi guys.
Hi.
Okay, so who'll go first?
I think I'll go first.
Yes, we don't do ladies first here because Zuu doesn't allow those things.
Hey.
I'm lying.
Okay.
I beg you.
Yes.
Okay, so my name is Dr. Ransom Annan.
Dr. Ransom.
Yes.
Wait, how do they spell that? I'm sorry, guys. I just need to know. Like, ransom as in like, I'm going to ransom someone, ransom.
Yes, exactly. Ransom. Ransom.
That's your first name.
That's my first name.
When you said it first, I thought it was like you're a rapper on the side. And that was your rap name. But okay.
No. That's
I wonder
the
what the
name I have.
background was from, like his parents, like why they called him Ransom.
Well, I was named after a very close family friend
Oh, okay.
of my mom. So
Was he a rapper?
no.
So let's go.
Let's check it.
Okay.
Yeah.
Okay.
And I'm the dentist.
Okay. The dentist.
That's right.
See, I brush my teeth extra well so that when I'm smiling, you don't come and say, you have some plaque here. Okay.
Okay. Hi, I am Dr. Eliza. I'm an optometrist.
Okay.
Oh, wow.
Nice to meet you all.
Wow.
Same here.
You guys, I'm so pleased and honored to be beside two learned people.
Yeah.
And 2.5 learned people. So
Look at you. We'll see who is who very soon.
don't worry. So yeah.
Yeah, so we are so excited. They are joining us from Whitestone. Can you guys tell us about Whitestone just a little bit? Like what
Okay.
Whitestone is here.
Okay, so Whitestone Dental and Eye Care, it's a company, or it's a clinic that started somewhere in December 2023.
Okay.
So we've been around for close to 1.5 years now.
Okay.
Yeah, we started initially with a dental clinic, and then we've added on to the eye clinic as well.
All right.
So we provide all the types of dental treatments that are available currently, and also with the eye services as well.
Okay, perfect. But you guys know that me and Zuu there, we need some closure. So we brought them here because we need some information about things.
Yes.
And I know we usually have a script, but this one there is on my chest. So I just have to ask. There was some time that me and Zuu went out. Me, I come to open Zoo's keys. And Zuu spoke to some girl. And Zuu was like, Afi, the girl's mouth was really smelly. I'm sorry, guys. I have to say it now. As a dentist here, I just have to say Zuu is laughing because he knows I'm not making it up. I'm actually not making it up.
Oh my god.
And me and him had like an extensive conversation about bad breath. Like when people have bad breath, do they know that they have bad breath or not? Like, because me when my mouth is smelling, I know that my mouth is smelling. But it seems like some people, they are very confident with the bad breath. So
Yeah.
can you touch on that for us a bit before we even get to the episode?
Yeah, that's an interesting topic. I mean, bad breath. We call it halitosis.
Halitosis.
That's the or malodor. That's the term that we give to it, and it's something that is very prevalent, and it can be divided into at
Sorry, when you
least
said
two.
prevalent, so open his mouth like this can't be real. Like, okay, yeah.
Sorry, go on.
Yeah, so basically, for halitosis or bad breath, it can be divided into two groups.
Right.
We have the transient halitosis, that is the fleeting one, the one that just comes and then it goes, and then we have the real halitosis. Yes.
I'm sorry, guys. It's a medical condition. We shouldn't be laughing, but because he said the real.
Yeah. Yes.
Please, I need a difference. What's the difference?
How
between
do
the
we know
two?
someone's own is transient? How do we know that it is
It's real.
real?
So with the transient halitosis, it has been discovered that almost everybody at a point when you wake up in the morning, there is the morning breath that you have.
Okay.
That's the transient halitosis, and that one is just because you had a long night's sleep, and during that time there's very little saliva flow. So once there's very little saliva flow, there's some kind of putrefaction that goes on with the little food particles and then some bacterial action. So within the early hours of the morning, you can tend to have some form of halitosis, but that goes quickly. Once you brush and you start eating, it disappears. So everybody has a form of halitosis, I mean, early in the morning. And then we have the one that has a real cause, which is the real halitosis. So even with that, we have two groups also. Yeah.
I'm sorry, it gets more complicated.
Yes. So we have the perceived halitosis, and then we have the actual clinical halitosis.
Okay.
So with the perceived halitosis, you realize that there are some people who are obsessed with their mouth, the smell from their mouth.
Okay.
So for them, their halitosis is not really something that exists, but it exists in their mind.
Okay.
So
Psychological halitosis.
Yes. And there are real people like that. I have met people in my practice.
Yeah.
They come to you, you start with the treatment and everything. They go and come, and then they keep coming.
That no, I still feel like my mouth is smelling terrible.
So,
but then, will you say, so I'm asking this question for myself, guys. I really like onions and garlic. Like, I feel like they are just a flavor best. But whenever I eat them, I know that my mouth is smelling some type of way.
Exactly.
So will you categorize that as transient halitosis? Or if I keep eating it all the time, it can become a persistent or a real halitosis?
It can become a persistent, yes. Because when you look at the cause of the real halitosis, it's basically a combination of your eating habits, and then your oral health habits that leads to, because nobody is really born with halitosis. It's something that's acquired as you grow up based on your activities and then your lifestyle. So things like onion and garlic, if they are consumed for so long and you don't brush immediately after, or you don't try to mitigate the odor that comes, it can become a lasting smell that gives you some form of halitosis.
You vegan, have you heard?
Hey, I'm here right now.
Okay, that's very interesting. So when someone comes to the dentist, how do you know they have halitosis? Do they have to do like, and you be like, oh, you can just, once they open their mouth, you can tell that, like, how will you know?
There are some that are very obvious. I mean, once they enter the room, they change the atmosphere in the room. I mean, that is very, very obvious. And there are real people like that as well.
Yeah.
You tend to come across them every now and then. But there's also an objective way to test for halitosis by doing a breath test. So there's a breath analyzer. You blow into it, and then it can detect.
I wish you brought it here today, man.
Yes. So once you take the breath test, it has a system that detects there is this what has been found to give that particular odor sulfur containing compounds. So and they are volatile. That means they kind of
move
they move freely. They are like in the breath.
I'm sure you might and a half.
So the test is to test the presence of that volatile sulfur components in your breath.
Right.
And that can help.
Onions and garlic are high in sulfur.
Yeah.
That's true. So guys, eat it with caution.
Like we are smart here. Actually.
And then
I have doctors.
Oh,
and
yeah,
dentists
yeah.
already.
we are graduates and grad ones.
we
So.
know inside small.
And then how do you tell someone that they have halitosis? Like how do you tell someone that your mouth is smelling? Go and get it
wait.
checked.
Before you answer, please, assuming you were a dentist
Mm-hmm.
and you were breaking the news to your patients, what would you say?
No, that's different. So that one is a dentist. So that
I
one
just want
here
to
is
hear how you
normal.
say it. If
That
it
one,
was
as a dentist, I would have said, oh, I've checked your oral hygiene. I've looked at it, and it seems as if there are certain things that you can do to improve it even better. And then I'll explain the sulfur thing to them and ask them what kind of things they eat, whatever. And I'll tell
But
them
shouldn't
that
you just say, it seems you have a case of
halitosis.
halitosis?
Well, if the person is familiar with the term, maybe I think it's more of a cultural something. In the Ghanaian setting, it's quite people shy away from telling people the truth in their face. They feel like you are disrespecting them or you are trying to embarrass them in a way. But to break the news to someone that they have halitosis, what I have come across people doing is they tend to find a way to get the person to have a dental checkup, either a free they pay for the person and say, oh, there's this promotion going on somewhere and I want to
cut you. I want to give a perfect example. What if your company does medical checkups?
Yes.
And there's somebody in your office, their mouth smells, but they've gone for medical checkup. They go for medical checkup every year, and they go for the dental checkup, and there's no improvement. So that one, does that mean that the dentist didn't see it, find it?
I wouldn't. Then there must be something else the person is not doing. Yes, because once you have halitosis and you come to the dentist or you're attended to, it's very likely that we can put a stop to it. If not completely eradicate it, it should drastically go down.
Okay.
Yes.
Okay, so I'm coming to you now. You've had a long break.
She's just been there laughing about it.
So even before my first question, before we get into the real optometric, is that weird?
Yeah.
Conversation, yes. So imagine if you guys both work at Whitestone, you have a dental clinic and an eye clinic. Do you guys work together? Like, let's say if you're checking somebody's eyes and then they see someone or two, you're like, oh, you're Ransom.
Somebody there, yeah, when you come check your eye, but
we need some help. Do you ever do that? Do you ever recommend people? You guys recommend people to each other's departments at least?
So far, I haven't had a case like that.
Okay,
So
thank
I
God.
haven't
reach that point.
reached that point. But then I do recommend that, we have the dental side right downstairs. So
Okay.
just go and get your teeth checked.
Okay.
Okay.
Nice.
All right. So I think let's just backtrack a bit. Sorry, I would like you guys to just share how long you've been in the field, so that people know that we are talking to experienced people. We're not
exactly.
bringing you some
very
quack
key.
doctors. They are
Very
real
key.
doctors. Can you tell us just how long you've been in the field and how it's like working at Whitestone? Give us some of the drama that's been happening. I don't know, something. Just tell us some stuff. Yeah.
Yeah, we'll start
You
with
first.
you. Yeah.
Okay, so I have been practicing for about 3 years now.
Okay.
I went to KNUST.
Mm.
Yeah. And I have been at Whitestone for about 2 months now.
Okay.
Okay.
The eye services at Whitestone opened just recently.
Okay.
So
Yeah.
I haven't been there for long. So I don't
Okay.
know too much about the drama.
Okay.
Yes, but so far everything is really cool. I like
Yeah.
the office space.
Yeah.
You know that. It's a crash stress that is stressing my life.
Yeah.
Traffic.
Same.
But the work
Ah.
setting is really cool.
Yeah. And I also think the place is really cool. Me and Zuu visited, I think, a month ago.
Yeah.
Yeah, we like
Yeah.
the space,
ambience.
the ambience, the
Yeah.
blue and white. I think it's very on brand for like teeth and eye.
Yeah.
Yeah, the setup is cute.
Yeah.
Yeah.
It was very chill. And what about
Okay,
you?
so I've also been in practice for 7 years after school.
Mm.
Yeah, so and I've been with Whitestone for the past 1.5 years.
Okay.
So
Okay.
Yeah.
Interesting.
Nice.
Okay.
So any drama?
we've been
Any drama?
Any drama?
Any drama? Somebody has come to do their braces or their Invisaligns and they can't pay or something. That's the kind of drama. That's the kind of tea I'm looking for.
well, we've not had any kind of real drama, but we've had funny, kind of a funny case. There was this very old lady that came, elderly woman that came, probably in her 80s, getting to her 90s, and she came. Apparently, she's been living in the UK for so long, and then she came down to Ghana, and then she wanted to have a dental checkup. So she came to me, and the first thing she does was to show me all the crowns and the bridges that are in her teeth. And then she tells me that she did all this in UK, but she doesn't want them anymore, and she wants me to give her brand new teeth at her age. And I was like, hey, grandma.
You literally said, hey, grandma.
Yeah, I told her, I was like, this is the first time I'm hearing an elderly person say she wants brand new teeth.
She's ready.
Yeah, I mean, and she was like, once she still has life, she has to be on top.
Yes.
Because
Okay.
in those days, nobody could beat her up. I mean, in terms of taking care of her teeth and everything. I mean, it was quite hilarious too. The way she spoke also in Tree, it was quite funny.
Oh, that's cool.
Yeah.
So do you think you can ever be a doctor?
I can be a doctor.
If you had to choose between being an eye doctor and being a dentist, which one?
Oh, eye doctor, easy.
Are you serious?
Me, my ways. I've already spoken about halitosis already. That's the worst. I can't do. Because I also feel like largely the things you will see, the things you will see, I think yours will be easier to handle.
Are you sure?
Yeah.
Are you sure?
But some things inside some people's mouths is scary. And so I feel like
No, but what's the worst thing you can see, like eye-wise? Like, what are some of the things that you can see, like, yo, this is really bad?
like red eyes or something like.
I don't know.
No, there's so many things.
Sorry.
Yeah, because I feel like people don't talk about like eye health as much,
Yeah.
but there's so much. Yeah.
Yes, so you can have retinal detachment. That is when, like, so I don't know how to explain. So the eye is there, inside the eye, the back, there's something like the retina.
Yeah.
That's where the light hits for you to see. And it transmits from the eye to the brain,
Right.
all those things. So you can have retinal detachment, like the retina tears away.
Mm.
And so in that case, your vision is very reduced. You can't see.
But is it visible to you? Like, can you look at someone's eyes and be like, oh, your retina has been detached?
Yes. So the person will usually complain that I'm seeing flashes and floaters in my vision.
Right.
And when I check, there are some signs that I see. So you can see the back of the eye. So you dilate, check the back, and you can literally see the retina like floating.
That's wow.
Sometimes it's, and there are hemorrhages. Like I think just 2 days ago, I saw a man who came about like 48 years. Said he can't see well. He has done cataract surgery. I'll talk about cataract later. He can't see well. He has done cataract surgery. Should we change the lens in the eye? So I checked the eye for the left eye. The back, there was bleeding everywhere.
Oh no.
Yeah, and when is that way, you can't see well because like there's just blood everywhere.
Is it painful?
So no, usually it's not painful.
Ish.
So there are actually serious things, and like there are other things too, like retinoblastoma. It's like a cancer. Usually happens in children, and it's very dangerous. Yeah, and there are the simpler ones like cataracts, which almost everybody gets cataracts. There's that. Yeah,
Relax. At what age?
And nothing happens with aging. So maybe from like 60 going, yeah, you can get cataracts. Even less, there are some risk factors too. Like those who use steroids, those who bleach a lot, are susceptible to getting cataracts. Yeah.
Right.
Yeah, other things like that as well.
So what's a cataract? Is it like something that comes on your eye? It's like a
not
film.
on the eye itself. So there's something in the eye called the lens.
Okay.
So with cataract, the lens is usually supposed to be very clear, like transparent, so that light can pass through to hit the retina and then transmit to the brain and all these things. So with cataract, what happens is that the lens becomes more translucent and it gets opaque. As you are growing, there are deposits, so it's becoming less and less. So for that, some people you can see it like the inside of the eye looks kind of white for old people. Yeah. So that's
I think I saw that in my dad's eye at the point.
So did he do surgery?
No, he didn't. He used to wear glasses.
But can you
you
still
could
see?
see some white lining around in the
No, that one is a
pupil.
different thing. That one is
Okay.
acus senilis.
Ebe. Which one is that one?
Yeah, so it's also something that happens with aging.
Okay.
Just
Yeah.
around the eyes.
Yeah.
Yeah. Normally, that deposits, lipid deposits. So usually, when it's a lot, it's probably that the person has high cholesterol.
Yes,
So,
that's true.
but one thing is that most of these conditions happen in old age.
Yeah.
And with conditions like hypertension and diabetes.
Mm.
Yes. So for younger people, it's mostly refractive error, and then what else? Digital eye strain and.
Oh, but so are your eyes good? Do you think your eyes are good?
I have refractive error actually. Yes. So I can see well, but glasses make my sight better.
So you wear
Right.
glasses?
Yes.
Oh,
But not all the time.
Thanks for the honesty. I appreciate it. I wear glasses, but not all the time. I've been wearing it for like 2 years.
2 years.
Yeah.
The one is bad. My glasses are right there.
Yeah, I've gotten the new this thing, so I'll come and do it outright.
Sure.
Yeah.
Interesting.
So the interesting thing I think for eye is that, as you've said, so much can be going on in your eye and you wouldn't know until it's too late. And I feel like it's something that needs to be actively preached. People need to go to the eye doctor often and just have like checkups, because you might think you have 10/10 vision but you do not, or you might think there's nothing going on in your eyes but there is.
Yeah.
So
That's true.
so what?
At first glance, what do you think about my eyes?
Oh God.
Well, I mean, I'll need to do further tests to really see how your eyes look like. But from here, they look okay.
Just okay.
Just okay.
My
Further
eyes,
tests to prove whether it is good or
my eyes are perfect. I can see everything.
really.
Yeah.
How
That,
do
I even
you-
have a question. Are there some people who come and they can actually read all the letters?
Yes.
That is so
That's me.
scary. Must be nice.
Yeah.
Are you
I
serious?
always usually read
Yeah.
all the letters.
So you read up to the bottom.
Usually.
Could never be
Is
me.
it like 6/6 vision or 20/20 vision?
20, which one is 6? Which one is better?
It's the same thing. 6/6.
oh,
It down to
20/20.
meters. 20/20 is feet. 20 feet. And then 6 is 6 meters.
All I know is that the eyes are perfect.
You
The
will
last
take
time-
it to
Some
Whitestone and
Beyond
check
that
again.
too. Some people see beyond the 6/6. Like you can see 6/5, 6/4, 6/3.
I have to check again, but
Yeah, you have to come and check.
recently I was standing on a balcony with a friend with glasses, and she didn't have her glasses on, and like I was reading all these billboards like from far, and I was counting like cranes,
No, we will come
cranes
to
in the
Whitestone.
background.
I
She
will
said
come.
she can't see
We
anything.
will go to Whitestone and check
Yeah,
your
we'll
eyes.
check.
Yeah,
Go
you
ahead.
How to
to
verify?
Yeah.
We'll make a video.
Verify his claims.
2020.
Yes, you have to verify your claims.
Can see everything. Almost X-ray.
Hey,
That's funny. So yeah, should we get into the questions that we're supposed to ask each other?
yes. Since you claim that you are so smart and you know everything, I come to play a game. You guys know I like games,
Yeah.
so we are going to see how well does the eye doctor know the teeth doctor, and how well does the teeth doctor know the eye doctor. Not with respect to their personal lives, but with respect to their fields.
Yeah.
And Zuu, since you know so much about the eye,
Yeah.
we would ask you about the eye.
Okay.
Because since you know so much, since you have 25 vision, so I'll team up with her and we ask questions.
Oh man.
I'll team up with him. I'm even getting confused. No, I'll team up with her and we'll ask you guys questions.
Okay.
And then you guys can also ask questions
It's not
about.
really low. I can see him.
Yeah, Zuu, no. Hey,
I'm
you're
finding
cheating,
questions to
no.
ask.
Hey.
I'm finding questions to ask. Don't worry. Don't worry.
So
don't
three
worry.
questions
Finding
each.
questions for you.
3 questions each. Since you are you're ahead of the game, you ask your question.
Oh wait, I'm now looking for the question.
Okay. So me and you versus them. Please, you have to think of very hard questions for Zuu, because Zuu is acting like.
Oh no, it shouldn't be hard. What are you talking about?
Eliza, do you have questions?
I'm
That's
not sure,
actually
like
difficult.
the level.
No, hard questions. The ones that when you saw it in your exam, you were like, oh God.
No, a question that you think a doctor can answer. A dentist can answer.
No, but you also don't want him to answer. We are supposed to wait, no, relax.
Or to the dentist wannabes. What are the signs of oral cancer?
What are the signs of oral cancer?
Yes, give me some signs.
Okay.
It's like pool.
Receding gum line.
No, I don't think I don't have that here.
Please, Eliza, you can't be hot. You can't be sitting down not doing anything.
Yes.
These are like pro questions.
Question, right?
Throbbing,
Uh-huh.
tingling sensation
Where?
in
And how?
the gum.
The
and
gum,
teeth.
in the teeth. No.
Maybe chronic pain.
Persistent mouth pain.
Yeah,
It's a sign. It's a
that's-
sign.
Thank
It's
you,
a
thank
sign. It's a
So
sign.
this question is supposed to be one answer.
So simple. When I say it to be like, oh, I should know this. Should I answer it for you
Yeah.
guys?
Patches.
So you've gotten it wrong. Yes, actually.
Patches. So that's all. Wait, we're not going wrong. Patches, mouth sores. Patches and mouth sores.
Should I read the answer?
Oh,
we
doctor.
got
But
two.
doctor, you are nodding, so that means it's correct. What we are saying is correct.
We've gotten to. Okay, give me one more. If I give you one more, then you got the question right.
Ish. Doctor. Doctor.
No, you said 3. You said what?
We said sores,
Persistent
Chronic pain.
And patches.
the patches, yes.
Yeah.
Yeah, that's actually. So
Yeah.
signs of oral cancer include sores in the mouth that do not heal,
Exactly.
lumps.
You have to add that do not heal.
Yes,
heal, yes.
lumps or thickening in the cheek,
Okay.
white or red patches on the gums,
I'm so
tongue
smart.
or lining
I'm
of
so
the mouth, difficulty chewing or swallowing, and persistent mouth pain. So, yeah,
We are
you've done
too
well,
good.
you've
We
done
are
well,
too
you've done
good.
well.
Come on, guys. Clap for us. Clap for the girls. Clap for the girls.
Yeah.
Liza, do you have your question ready?
Okay.
I'm ready.
This one is a simple one.
Yeah.
Okay.
I think you even asked it. So
Yes.
what happens to the pupil.
Mm-hmm.
First of all, what's the pupil? That's 1A. 1A. 1B. What happens to the pupil when you are in bright illumination and then when you are in dim illumination?
Yes.
Oh.
It's very simple.
I'll
Very
answer
simple.
part 2, you answer part 1. What is the pupil?
I should answer part 1.
Yeah, I'll answer part 2 for you.
Let me look for a question too. Now that it's
I think
on.
the pupil is the black, very dark, rounded point in the center of the eye.
Right?
Okay.
Yeah.
Say it again.
See the dark round part of the eye.
The very dark, rounded portion, as in the center. When you look in the face of the eye, in the iris.
Okay. Yeah, I think it's kind of correct.
Yeah.
Okay, it's the opening.
Yeah.
It's actually like a space.
Mm-hmm.
Yeah, exactly.
You there, tell us what it does in the dark, like I said, like.
Bright
So
and dim
the
illumination.
people in dim lights, it expands. You know,
What's
it
the technical term?
dilates.
Correct.
I can't even be a hater.
And then in bright illumination,
Contracts. That's a contract.
constricts.
Constricts.
But yeah,
But it means the same thing.
Downwards.
Right?
Yeah.
So
Yeah.
But it does in order to let more or less light in. So
You're too good.
yeah.
Too
Very
good.
That's why I
bro.
said you want to be an eye doctor. Yeah, I agree.
Next week, people, you see me at Whitestone with my lab coats. Don't ask
Yeah.
questions.
Don't ask question. Rasta doctor. Okay, it's your turn again.
Okay.
Ransom, do you have a
Can I
question
have a
for
que-
us? Yes.
Okay. So
Hmm.
my question is simple. You should be able to get it. How many teeth do children have? And at what age do they lose all their baby teeth?
No, but that's not fair because my nephew, all sorts of things are going on his mouth. There's even one teeth growing at the back. So what if I
on
say
average.
Okay. Let me change it. Let me reframe the question so that you get it.
correct?
How many male teeth do
Okay.
we have in human beings?
Oh,
And
doctor,
at what age
doctor,
do
please.
you lose all your male teeth?
Yeah, but this your question there is difficult.
No, it's not difficult. It's a
difficult.
So
very
you know the
easy,
answer?
straight. Oh yeah, I can't tell you because it's your question.
We know it.
Yeah, we know.
I don't
We know.
trust.
We know. So,
Why
what
do I
about
feel
you
like
guys?
60.
60.
60.
Oh yeah,
20.
60.
Most people know the adult one.
Yeah, that one.
That
Yeah.
was I mentioned that one.
They have 20, 22, 24.
24.
So they got it
Yeah.
wrong.
And then all of it comes off at what age?
Ah.
But we have to put this together. Why you looking at me?
It's not 24.
It's not
So that
24.
one there we know. So it's not 16 either.
No, it's not 16.
Is it between the two?
Is it between,
Between
the
the
two?
two. Yes.
20.
Yes.
Woo!
Wow,
So you knew the
wow,
answer.
Wow.
So 10 on top and 10 at the bottom.
Yes.
That's so
Oh.
cute.
Right?
And when did they lose all?
Oh, this is very,
Before they
it's
are
very
10.
simple, guys. Come on.
Before they are.
That's close.
That's two. That's close.
7.
No. It's
It's much older. Because I see how like my nephew is older and his hair has come off and I've been laughing at him.
Motorway.
Motorway. I feel like you get motorway when you're much older. So
Oh,
before 12 years.
Motorway is
yes. Between 12. It's usually a range, so between 12 and 14.
12 and 14. Nice.
Yeah.
Yeah.
I'll give it to you.
Thank you so much. Thank you so much. Thank you so much.
Easy,
You know,
easy question, guys.
I have a lot of entrenched milk teeth. And I'm scared because whenever I go to the dentist, I'm sure when I come to you, you tell me the same thing.
Like you have to pull it out.
They want to remove it. At this my big age, what if it doesn't grow?
Yeah, that's life.
Well,
What do you have to say about
your
that?
milk teeth are not supposed to grow past a certain age. So if they are there, then they're not doing it in
They're not supposed to be there.
they're not supposed to be there.
So when you remove it, are you sure the adult one will come up?
Not likely. It's not likely.
So that means it's good I've met you because that means the other dentist, he lied to me. He said, oh, they have to remove it.
Yes, they have
That's
to
for the
remove it,
best.
but then you have to rearrange the rest of your teeth so that everything lines
I mean,
up
my teeth
well.
are not even 32 already. So what are you removing to? It's okay. I don't even want anybody to come. It's okay. Never mind.
Most often, if your baby teeth remain, there are two things that it does. Number one, well, basically it causes an obstruction because that position is supposed to be replaced by a permanent tooth.
Yes.
Yeah.
So if it's not coming out, then it means that the permanent tooth is not going to erupt, or when it tries to erupt, it is deflected into a different position. Yes. So there are cases where people come and say, my child has 2 sets of teeth in their mouth. Yeah, it's just that the baby teeth have been persistent. So we take the baby teeth out, and then we push the adult teeth into the position, and then it lines up nicely.
Is it something that is genetic?
Yes, it's controlled, largely genetic.
I think so, because my nephew too has. I'm sorry, I'm opening your keys out here, baby boy. But he has one of his milk teeth that are being stubborn right now, and I feel like same as the eye. If you are not actively going for dental checkups, you don't know that you have entrained teeth, and you'll be like me with 2 milk teeth, happily sitting at the bottom, not coming out.
Yeah.
So yeah, this is interesting. Let's just do one more question. We'll do one more question and we move on.
What are the types of color vision defects?
Color blindness.
Yeah, what are the types of color vision defects?
As in like color blind. Right. Yeah.
So what are the types? This is both of you.
Yes.
Okay, so you have to give us a clue. How many are they?
How many are they?
Before we say them.
Okay, well, the simple classification is 2.
So you can do it.
I can even go deeper. So this is the
Basic.
Yeah, keep it this way. Keep it this way, because you see the viewers are watching. We don't want to confuse them too much. You understand?
Yeah.
So basic.
Just keep it basic. Yeah.
Yeah,
So 2.
just 2, yeah.
Do you have any ideas?
Hey.
If
it's dentistry, you'll be talking to her.
We know.
I know.
We know, but we just don't want to be too.
Yeah, we don't want to be too. We want to make you win the competition.
So
that you'll be happy.
No, we don't want to
So
win.
see, if I was watching, I feel.
Give us some clues.
I can't really
Give
give
us
any
some clues.
I like.
Like-
We make a great team. We make such a great team.
If I was watching, I feel like
So
I would
green,
choose something
blindness
like.
to red color blindness.
Okay, that's another classification. That's not what I'm looking for, but
No,
we have red, green,
yes,
and
red, green,
we have
yes,
blue, yellow.
yes.
Okay.
That's
what I was
that's what.
looking for.
What you're looking- No, that's what I was going to say.
No,
red.
No, I was going to say the red green thing. Sorry. You say
Okay, so the simple one I wanted to hear was congenital and acquired.
yes.
Very simple.
You see, we're thinking about the colors,
specific the way you ask the question.
Hey.
That's it.
The way you framed this was a little,
Yeah. So we're
Yeah.
the same.
yeah.
Oh
They got us confused.
So next time,
Hey.
answer,
We knew it-
ask
we
it
knew it well,
properly.
yeah.
You
So
didn't
how
ask-
should I ask?
Oh, you should have said in terms of,
In terms of I know.
how people get it and things like that.
Yeah.
Okay.
So at the end of the competition, it's obvious.
Yeah.
Who runs the world, girls?
Hey.
Okay, so let's go back to the actual conversation on health care. I think we've been talking about how it's important for you to get checked for both your teeth and your eyes. So can you guys tell us how often should you do it in a year, or how many times per in your lifetime, or whatever?
Okay. So for the dental, or for your dental health, American Dental Association has stipulated that you should have at least twice checkup every year. So every 6 months, you can have a routine dental exam.
What does the Ghana Dental Association say?
We agree with the Americans. We basically agree with them.
Okay.
Yes. So usually a dental exam or a regular dental checkup would involve the dentist looking through your mouth and looking out for any the early signs of the common dental problems, such as cavities, caries, and then periodontal diseases, gingivitis, and things like that. Those are the basic and common things. So once it's detected early, a simple filling is all you need, and then you should be okay.
Okay.
So do you ever have the case? I'm sure you would agree though, but I know it's a very Ghanaian thing where someone has a problem, and instead of them to come to you guys early to assess it and then sort it out, They will just wait. And sometimes you ask them, "Oh, how long have you been having this problem?" And you see something like 4 years, and you're like, "Ah."
The interesting thing about that question is that some, even after all that, they still come and tell you a lie that, oh, it just started last week.
But you can see that.
See
Yes,
that? No,
You
and
can see that this is plaque.
And then I go and say that, please, this thing has been there for at least 2 years. And you say, doctor, it's true.
Oh no.
Yeah.
For mine, the
I
annoying
think-
part is
yeah,
right.
yeah.
For mine, the annoying part is they'll like there's something wrong with your eye. Instead of you to come to us, you go to a pharmacy or over the counter,
Eye drops.
go and get it, and it doesn't work. People are now coming to us.
Yeah.
Like,
Yeah.
I think we shouldn't play with our eyes, especially. We just be putting random things. I'm
Yeah.
guilty though. Like I'll go and buy the dry eyes. You know, like when you have dry eyes, you can use like if I'm straining my eyes too much, I'll go and buy some, just fire it into the eye.
Yeah.
Actually,
And I think it's becoming more, I think
common.
it's a cultural thing
yeah.
because Ghanaians tend to listen to their friends' prescription or what a friend will prescribe more than what the doctor says.
It's true.
Yes,
That's so true.
I've had people come to me and I'm like, they have to take out their tooth and they're like, oh no, I don't want to take it out. I said, why don't you want to take it out? I've heard that if you take it out, you have a big head and you can die. I've had that so many times. I
You will
can't
get
take
a
it.
big head and die.
Yes. So
big head.
as in your
Like
head,
head will just
your
keep
head
swelling,
just keeps
swelling,
swelling
you
and
just-
then you die.
That is-
From both young and old, people that you thought should be
Yeah, it's
educated.
funny, man.
I've had it
wild.
so many times, and I always have to go back and then explain and all that. So they will prefer what their friend will say. Oh, when I had a toothache, I just used this solution and I put it in there, and then the pain stopped after 2 hours. Yeah, and you realize that it works initially because what they don't know is that the chemical that was used actually caused injury to the tooth
So the
by
nerves have been.
killing the nerves, but didn't take care of the infection. So when the nerve dies, the pain goes away, but then the infection builds up, and then it causes a more severe pain,
Yeah.
and it destroys the bone,
And the
and it
gum.
causes so much problem. I've had a young man pass away because of that. He came to me somewhere like 3 years ago. A young
That's
man about
crazy.
between 30, below 40 years old.
That's wild.
And I told him that he had to take out his tooth. And then from the way he was behaving, I realized he wouldn't come back because he just wanted me to give him some medicine to stop
Yeah, the pain.
the pain. I kind of advised, he was with his friend. So I told him that they shouldn't try to use this herbal treatment and herbal medication. They should just make sure that they come back, we get a tooth out, and that. They left the office with the medication. We didn't hear from them. And then the next time this friend calls me, they called the nurse and they were like, they want to see me urgently. And what's the case? They said the guy has been rushed to 37. They said there's no bed. They took him to college. They said there's no bed. Apparently, they're going to apply this herbal concoction, and the guy has had a very huge swelling. So by the time
now
they
the
tried
head
to
swelling
find,
Grew and
Yeah.
he
Grew
died.
from not removing the teeth.
so by the
rather.
time they tried to find the bed, he died.
Oh, no.
He died in about 10 days after he came to me.
That's crazy.
Nah, you guys, like, we
Yeah.
really don't have to take our health as
So,
a joke. Like,
Yeah.
So listen to your friend about, your toothache. It's neither here nor there.
Yes.
You should just have a checkup. Once you feel something, it's always better to have a checkup.
Guys, there's a herb issue. Do you know some people put herbal concoctions on the eye?
hey, you
People
people
are
are
brave, oh.
dangerous.
On the eye, herbs.
That's
very
crazy.
brave.
That's crazy. So I'm sure you also have the same issue where people come and they tell you that it's been 2 years. Like, how can you wait for 2 years before you come? Yeah, that's my mother's favorite thing is you don't sell dash on the market. So whether it's your eyes or your teeth, or she says that to me all the time. So it's like, Charlie, if you spoil your eye,
You're not gonna get
that's
it.
your only
Yeah,
eye.
yeah,
yo.
yeah.
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 And even for the teeth, maybe you can even get the
Veneers and stuff like that.
Yeah,
But
for the
but for the
eyes,
eyes,
you
just
can't do eye
irreplaceable.
transplants.
Yeah.
you just get a fake eyeball and put it there.
Yeah,
That's
exactly.
But you can when your eyes then
Yeah. So I think the one of the first things to do is to tackle that cultural thing. We must try and change it. Most people, and this is from telling your friend says, oh, I have this problem. Instead of just saying, oh, I took this medication.
Yeah.
They do that a lot.
It's better you always tell the person, oh, have a checkup. Go and see your doctor, see your dentist, see your
Yeah.
eye specialist. It's always safer.
Yeah, better
always
safe than
safer.
sorry. And
Yeah.
it becomes cheaper. You feel like, hey, I'm going to pay consultation. last time, this one I have to call my mother out. I know you're watching. I know you're watching. She went to the ear doctor and she said, I want to waste all my time. They took so long and there's nothing wrong. And I said, so did you want to go for them to find something wrong with you? And I think that's the thing. Like when people invest so much money and then the dentist says, oh, you are fine. Oh, the pain is normal to go. It really bashes them. But when you really think about it deeply, that closure is better. Like going for them to say, oh, there's nothing wrong, as against keeping it and then something will actually be wrong and it ends up being way more expensive. And Eliza, you didn't tell us about the how often for eye. So can you share that as well?
Okay. So for adults, once every 2 years is what is recommended. That is normally if you don't have any issues, but if you have any conditions, you'd have to come in more often. So if a practice error, you change the glasses every 2 years. Yes, but then for older people who have issues like diabetic retinopathy, hypertensive retinopathy, those ones maybe every year or every 6 months. For cataracts, maybe every 3 months. So it actually ranges depending on you and your condition. But for adults, every 2 years, you have to check your eyes.
Oh, then I have to come for an eye test.
Yes.
Because I feel like the last time,
interested in yours, man.
the last time I checked was like 2021 maybe. So it's time, isn't it? Yeah.
And I want to ask a question about I just got a tongue scraper and I just like I'm in my dental health bag, the tongue scraper, and I also saw that there's the periodontal brush, like the tiny one. Like what's your opinion on that? Are those things helpful or is just fashion?
Oh, they are very helpful. I mean, we were talking about halitosis earlier. One of the main places where you can also get sources of the odor is also the tongue. Most people don't brush the tongue. But you should actually also brush. Because of its surface area and how spongy it looks, it can hide a lot of the particles, and then bacteria will go in there. So you can have someone who brushes well and always still has a mouth odor. Probably they are not brushing their tongue. So a tongue scraper does a better job at brushing your tongue than just using your normal brush. Yes.
So I'll get you one, okay?
Please do.
Yes, and then also with the periodontal brushes, we would recommend that more for those who are wearing braces because it goes in between the teeth. Because you have the braces on, you won't be able to brush well. But on a normal, with someone with a normal teeth, you could also use it if you have spaces. Sometimes people tend to have spaces in between their teeth. Yeah. So so with yours, you could also call it crowding.
No, it's okay. Later. I'll come and see you at Whitestone.
There's too much going on in your mouth.
You relax. We'll have consultation. Don't worry.
Okay. Yes.
Yeah.
So like,
With the crowding.
With crowding, you can also with crowding. It means that the teeth have interlocked spaces, and they are very tiny spaces that your brush will not be able to do a good job. So with the periodontal brushes, it goes in there, and then you can.
So what about flossing?
It's very nice. Hey, me, I don't joke with my flossing.
Yeah,
thank God.
Flossing is able to get into the tight spaces of your teeth.
Right.
It's better than the using of toothpick. Most people also tend to use toothpick, but that one can be injurious to your gum. Because the sharp edge. If you keep poking it every time, very soon it can become something else.
Very interesting. And then also the hard bristles. Let's do the myth buster now. Give us the closure. I feel like people feel like the harder their bristles are, the better the job it's doing. But for me, whenever I try using very hard brushes, it actually hurts my gums. So what's the right thing? Okay,
so so you can think of your brush or your bristle, if it is hard, like having sandpaper and rubbing sandpaper on wood for a while. You realize that it wears it off. So that's exactly what a hard toothbrush or hard bristle toothbrush does to your teeth. And if you have a hard toothbrush coupled with a bad brushing technique, people brush very strongly. I mean, they use all their strength. When they're brushing and you're passing by, you could hear the sound. Yeah,
I beg you.
So all that will lead to your teeth wearing off because the teeth are actually crystals. But they wear off. They can wear off gradually. So most often, a hard toothbrush will lead to a situation we call cervical abrasion. There's abrasion, which is like using a sandpaper abrasion, and then cervical because it happens at the neck of the tooth. And usually that portion is also much weaker than the full surface of the tooth. So that side starts wearing off. Then you start feeling sensitive when you drink a cold drink or you take a hot tea. You feel this sharp pain, and then once it persists, it can even lead to the whole tooth dying.
Eesh.
So a hard toothbrush is not recommended. There's one on the market called smoker's toothpaste.
Yes, I didn't want to name drop, but since you said it,
yes. It was designed,
Toothbrush,
I mean, basically for smokers.
Yes.
And that's the name of the toothpaste. I mean, if you're buying, you should
Yeah.
ask yourself whether you're a smoker or not.
yeah, smoker's toothbrush.
Yeah, smoker toothbrush. I mean, because smokers tend to have a lot of stains, but even with that, it's not recommended. You have to rather have a professional cleaner than using the hard toothbrush. Because the danger is to, number one, wear off the teeth, which will lead to sensitivity, and if it's not treated, it can cause the tooth to die.
I see.
Okay, so me, I'm okay for the dentistry for now. If you need more information, go to Whitestone, go and see Dr. Ransom yourself. We are not here to give you free consultation. We're here to give you information.
Honestly,
We're just giving you a small touch of the information. Go and see him and have a proper conversation.
Yes.
So back to Eliza before we wrap up. For the eye health, do you think diet affects your eye health? Because someone like Zuu is vegan and he eats a lot of carrots, and I know that they say carrots help with your eye vision and stuff like that. So are those things true as well?
So honestly, good diet like affects the eyes. Like good diet gives you good eyes, bad diet gives you. So if you don't, so it's not like the direct relationship that if you eat this food, your eyes will be better or not. I mean, carrots do help, but then if it's not like there's a food that if you eat, your eyes will be good, or if you eat some food, your eyes will be bad. It's more like if you have a bad bad diet, basically. If you do that for a long time, you develop some conditions, and those conditions can affect the eye.
Okay.
So like diabetes, hypertension. Bad diet over time will cause you to get diabetes and hypertension. And if you continue to have poor blood sugar control, poor BP control, it can cause some issues in the eye, like diabetic retinopathy, hypertensive retinopathy, diabetic refractive error. So it's not direct, but then basically if it's bad for your health in general, it's bad for your eyes.
Makes sense.
Okay.
And for people who have eye issues, what's like for you? What's the answer to the question between glasses or contacts? What's the way to go?
I think it's preference, what you would want. Yeah, but if you are someone who is lazy or you don't really like want to do a lot of work, then just stick with the glasses.
And if you're also not clean.
Exactly, because contact, like you have to be careful with contacts. Because if you don't do it well, if you don't use it well, if you sleep in it, it can cause other conditions for the eye. It can affect the eye negatively. So if you just want a simple solution, just go for glasses.
I don't know if you've ever seen this, but I saw this video where there was this lady who didn't know you're supposed to take out contacts.
So they had to layer and remove every single one of them.
So the contacts just kept going up and up and up. So she never took the contact out. So she has to go to the hospital and they pulled all these contacts from like some years.
Yeah, she's
and
lucky
all,
she wasn't
gelled
blind.
together and they had all gone up. I was like, wow.
I didn't see that video, but she was actually lucky because it can actually cause other things. Like the eye itself can have several issues. So she was actually lucky. Like
to still be seeing,
It's crazy.
And do you think people who are younger now are getting more eye issues than in the past, especially because like we're always using laptop screens stuff like that? What do you think? There's like a trend?
Okay, so general eye issues, I don't think so, but because we use screens more, we have more eye strain issues, like digital eye strains. Because you use the screens a lot, your eyes are exposed to all these light rays coming, so you get strained more easily. Eye strain.
So what's digital eye strain, and is it like a condition? Like what is it?
So it's basically some symptoms that occur when you use those screens for a long time. So what causes it is prolonged using of the screen. So that's basically eye strain. And then so what we recommend is for you to get glasses, anti-reflective and then blue blocking. Yes, to help to reduce the light entering your eyes and then to reduce glare as well. And then also take more breaks when you're using your screen. So there's something called the 20-20-20 rule.
So are you listening? Because he edits a lot. I'm saying it from a place of love.
Okay. So 20-20-20 rule. Basically, for 20 minutes, you're doing your work for 20 minutes. You're looking at your screen. Then take a 20-second break. 20-second break, yeah. So for 20 minutes, take a 20-second break by looking at something that is 20 feet away from you. So you are doing something close for a long time, then you take a break, like just look far away from about 20 seconds, you can come back to it. So 20-20-20. 20 minutes, 20 seconds, 20 feet. Yeah.
Okay.
And also lighting too. The lighting shouldn't be too much. It should be like ambient, warm light. Yes, that's better for the eyes than harsh light.
Okay.
So for someone like Zuu, who is always editing, when he comes to Whitestone and he gets his 10-10 vision as he claims he has, obviously he will not need glasses, we hope. But we can get him the blue light blocking one so that when he's editing.
Yes.
Okay.
So you don't wear glasses at all?
At all.
If you are using your screens a lot, you need to wear the glasses.
I do, yeah.
Yes.
If you insist.
Don't you get like headaches and like eye strain?
Not really.
Are you sure? How often, like how many hours do you like use the screen at a go?
I can use it. I can do like 4 hours straight.
4 hours straight, and you don't get any symptoms.
I don't get any symptoms.
That's interesting. But yes, you need to get the glasses, even though you don't need. You say you claim you don't need glasses
I really don't
for
get
sight,
but
you need the
blue,
anti-reflective.
you need the reflective one when you're editing, just for when you're editing, not for fashion.
I got you. I don't know, but if I'm getting it, has to be nice.
So definitely.
I'll use it for fashion too.
Exactly.
That's right.
So when we go to Whitestone, I'll help you select your frame.
All right.
You actually need to be getting some sunglasses when you're going out.
Oh yeah, I wear sunglasses sometimes.
Yeah. Photochromic lenses, when you're inside it's clear, when you're outside it comes dark.
Okay.
What it does is blocks the UV rays coming into the eyes.
Yeah, that's the one I need.
So when you're outside, so most times you have to be wearing sunglasses. You shouldn't just like send your eyes out like that.
But when we buy the sunglasses from the road, is that one dangerous? Is it better to get like a particular type of lens or something? Because I feel like my dad has passed a comment before that like you're always buying.
He said go and find some money and stop buying.
But yeah, like you always buying those sunglasses from Osu and things. It's not good for your eyes. Like he's passed a comment like that before. So what's your take on it?
I don't think it's that's the thing. You can't really verify whether it actually has what's supposed
the UV
to have.
blocking.
Exactly.
Okay.
So you don't know. Maybe just tinted.
Yes.
So I mean, it's best to get
it's
it.
actually called tinted. We should call it tinted.
Yes, call it tinted glasses. Yes.
So I think it's best to get it at the eye clinic.
But those ones are better than nothing.
Yeah, it's better than nothing.
It's better than nothing.
Yeah.
But it might not have the UV blocking, which is the main thing you're trying to avoid.
Exactly.
Right.
Interesting. Okay, so with Whitestone, what kind of services do you have for? Let's come back to dental care.
Okay, so with dental, we kind of cover every or almost every available treatment that we have on the market, from simple cleaning to tooth extractions to fillings to composite bonding, replacements, both removable and then fixed replacements. We have braces, Invisalign, surgical extractions, and then even with children, those who need corrective appliances, we do all the stuff. And we also have specialists that can come in when the need arises to do surgical procedures that are quite advanced also.
Okay.
Yes.
Do you guys have an X-ray? I know it seems very random, but I've been to like 2 different places where they'll say, "Oh, we need to get like an X-ray, but we don't have it here, so you have to go somewhere else and then bring it." Do you guys have an X-ray?
Yes, we do. We have the periapical machine, it's a digital X-ray
That's
machine.
cool.
But then there is also the OPG, which is a much bigger X-ray. Yeah, that one we are yet to have.
But it's in the works.
Yes,
that's really awesome. That's good. Yeah. Do you think I can get Invisalign? Talk. But the way my teeth is, it's okay. I'll come and see.
Invisalign is also.
We are a team. Don't laugh at me.
I said I come and see you.
Invisalign is one of the latest technologies available now for rearranging the teeth, and so it has complex systems that can rearrange your teeth.
Even this one.
Yes.
I'll
yes.
If people, you see me and you'll be shy.
You're
Oh.
not good.
Why so to change my life? People will be shy, especially the people who are sitting at the extreme end of this episode. They'll be very shy.
Okay, so what hours are you guys available? Like when can we come in? How do we get an appointment for both of you?
Your eye stuff, and then you can give us the info.
Yes,
Yeah.
so for the eye services, we do a comprehensive eye examination to check your eyes to see what is wrong with the eyes. Yes, we do refraction as well.
Okay.
That is when we test the eyes to see the refractive error you need. You have to get the exact glasses that you need, your prescription. So we do that as well. We also do binocular vision testing, color vision testing, contact lenses, and other stuff like that. Yes, but we don't do advanced stuff like surgeries. Yes,
Okay.
so for surgeries we refer to an ophthalmologist to get that done. That's the eye surgeon.
Yeah.
Yes, so our working hours are 8 a.m. to 5 p.m. Mondays to Fridays, and Saturdays 9 a.m. to 5 p.m.
Okay.
Yeah,
That's cool.
and then
And you keep the Sabbath holy.
Yeah, you can also book. You can also book for your appointments online if you go to Whitestone www.whitestonedentalclinic.com. You can book your appointment online.
Okay.
You can also call any of our numbers available on social media, and you can get your appointment also booked for you.
All right.
Yeah.
And I think you guys have an Instagram.
Yes.
Do you guys know the handle of handle? I should check.
I
Let me
think
check.
it's
Oh, you know.
WhitestoneDental.I.
Yes.
Okay.
WhitestoneDental.I.
Aye.
Okay.
Yeah.
So we can check all of that up.
All right.
Yeah.
So yeah, I think we've touched on everything that we wanted to touch on.
Yeah.
Thank you guys. Thank
Hey,
you to
wait.
our
We have to stay
experts.
by plan. Can you guys give us like a range of like consultants so that we can organize ourselves? Just a range. Like a range.
Okay.
Range-ish.
Let's say for someone who's coming for the first time, or you've not probably had a dental checkup in a while, you would need 150 cedis for registration, and then possibly you may need to just do a general cleanup. That would be about 450 cedis. So between 600 750,
That
you
should
should
be
be able
okay.
to have a good treatment on the first day.
Okay. That's
on the
cool.
first appointment.
Okay, so consultation registration is the same thing, 150. And for my side, if you might have to do a refraction test and tonometry to check the pressure, and then maybe that one's for older people. So let me just do it. Tonometry and then the refraction. So about 300 cedis. You might do more things like staining the eyes and other stuff. So average is 300 cedis, but you can go above. But if you're buying lenses too,
Oh, that one,
you have to
yeah.
prepare
Of
yourself.
later.
Yeah.
Exactly. So about 300.
All right. Okay. And you guys have a selection of frames. People can come and look through, get their frames as well, sunglasses.
They're very nice
Okay.
frames.
Okay.
I think we'll
Nice.
be there. We have a lot of homework, right?
Yes, I almost forgot. Before we go, we like to ask people, who would you like to see us talk to on Stay by Plan? Can be
Yeah.
anybody. You never know.
Anybody.
Wow, nobody comes to mind.
Nobody comes to mind.
Yeah. Okay. Afi, who would you like to see on Stay by Plan?
Stone Boy.
Wow.
Okay.
Yes.
All right. Then I'll make it happen. Don't worry.
Okay, thank you so much. Who do you want to see on the podcast?
I want to see Baomia.
Hey, please.
Baomia, please come on Stay by Plan. I have some
To think of
questions
that, I
for
want
you.
to see the ECG boss.
Do you know the ECG boss?
Recently, we heard of a 3-week
3 weeks.
outage or power, whatever coming
Yeah,
up. So you
that's
should come and
what
explain
they
things for
put-
us.
Yeah.
Yeah.
Oh, you've not seen?
I've not seen you.
Oh,
Was it announced 2
Oma
days ago?
communicated my say
That's
for the next
crazy.
3 weeks.
That's
There's going to be
crazy.
some-
Mad. Okay. Well.
That's wild.
Yeah. On that note.
Wait, we've not finished. You have to ask them the songs they've been listening
Oh yeah.
to.
Sorry.
And we'll ask them an easy question because I feel like these ones, they are not getting it. But what song have you been listening to that you like?
I'm listening to. I'm more of a Christian, so I listen to gospel music a lot.
Okay.
So CC Winans, All My Life You Have Been Faithful.
All my life you- Zuu, sing the rest.
That's, that song. That song. Yeah, I don't like it.
Hey, is that a song I don't like?
I don't like that song.
That's a
Yeah,
good song.
that's a
yeah.
good
How about you? No, you don't have to follow him in the gospel tree.
Oh yeah, but I actually listened to Defe And then
I
let's
had
say,
Do you know how they feel that was the song you listened? I don't know. You just
Yeah.
gave
Me
up
too.
the energy.
oh, Yeah,
I'm
I've been
so serious.
listening to it a lot.
Yeah, it's
And
a
then
good song.
yesterday, it's on that album.
I don't know that song.
Oh,
I don't
okay.
know
It's also
that.
really nice.
Okay, I'll check
Really?
it out.
Dancing vibes.
Zoo, sing it for us. Eh?
But yeah, so thank you guys so much for telling us the songs you listen to. If you guys like the songs, please go and listen to them. Yes.
And then,
And
what's your
yes.
favorite place in the Whitestone facility aside your office? 'Cause I know that's what you are coming to say.
Answer.
No, I like my office so much because it has ice stay and we have. No, what's your other favorite place in the office?
Just taking my answer.
Yo, you have to find a new one.
Where
Okay,
else?
it's okay if it's your office. You
The
just tell us
office,
about
yeah.
it. Okay, why is it the office?
Because that's where the action is. That's where the action is.
I'm crying. How about you? It's also the office.
Yes.
So if it was me, I'll say it's the kitchen.
Yeah, actually, yeah.
Like honestly, the office.
The office, eh?
Yes.
Where you are.
Fair.
Okay, that's good. It's always good to be happy in
Yeah.
wherever you find yourself. That means your workspace is fine. So that's cool. Okay. So Zuu, I think now I'm satisfied. Our homework is Zuu is going to do his eye test at Whitestone and we'll be sure or not whether he has 10/10 vision. And I'll be checking my teeth. And the next time you guys see me on Stay By Plan, you'll be shy because my teeth will be 32. Okay, the 32, I can't promise you that one, but like it will look good. It will look better.
Very.
So yeah, Charlie, thank you guys so much
Yeah.
for joining us, right? Zoom, I think I've stopped enough.
Yeah. Thank you so much for joining us, bringing your expertise on our show. Thank you guys as well at home for watching and listening.
Yeah.
And yeah, please check out Whitestone Dental and Eye Clinic.
Yeah. Thank you guys so much for
Thank
joining
you
us.
too for having us. It was fun and it was
Yeah, it was fun.
Nice.
educative as well.
Yes, thank you so much. Okay, bye.
Bye.
Stay by plan, across, stay by plan. All the boys, all the girls, for stay by plan. Stay by plan, stay by plan. All the boys, all the girls, for stay by plan.